Hi, it's me. And yeah, I know you've had a lot of questions. So I dropped a video a couple of days ago just before I went into one of my shifts at the Wesley Hospital where I'm doing some hyperbarics. And I don't know, this whole internet lit up because people wanting to know all about it. So let's answer some questions. Some of the questions that I've had in the last couple of days. First of all, the hyperbaric chambers in Australia, in hospitals in Australia, are medical hyperbaric units. So they're not wellness centres. They're not the woo-woo medicine where people buy themselves one of those zip-up bags from the internet and put a tiny little homeopathic dose of oxygen on themselves or nasal prongs and think they're getting hyperbaric oxygen. We're talking about grown-up hyperbaric oxygen therapy run by specialist hyperbaric doctors and specialist trained hyperbaric nurses in multi-place chambers in multiple centres around Australia. We've got 2 in Brisbane, and I just happen to work at one of them. So, typically, our treatments will be somewhere between a 10 metre or a 14 metre table. And what that simply means is that we pressurise the chamber and the patients and the nurse that's in the chamber with the patients down to the equivalent depth that you would go if you were scuba diving at 10 metres or 14 metres respectively. Now, when we pressurise the room down to those sort of pressures, just like when you swim underwater or go scuba diving, you've got to pop your ears so the patients are taught how to equalise as we're pressurising the chamber. We go down in the chamber, and then once we arrive at depth, which usually takes 2 or 3 minutes to get down, we then place all of our patients on 100% oxygen via a completely perspex hood. I'll try and attach some pictures as we talk. A perspex hood so that they've got 360 degree view. It's kind of like a space helmet. You'll get to see it in a second. And then what we're going to do is the patient will just sit and rest in an armchair, not dissimilar to the type of lounge chair that I'm sitting in now, and we'll breathe oxygen for a period of time. Usually it's about 40 minutes, and then they come off oxygen for 5 minutes where they get a cup of tea and a biscuit, and then they go back on oxygen again for another 40 minutes. And then over the space of around about 15 minutes or so, we surface the chamber. In other words, we bring the chamber up. So the patients themselves are subject to pressure and breathe 100% oxygen under pressure. So at 14 metres, you could say, it's probably incorrect to call it this, but you could say they're breathing the equivalent of 240% oxygen, right? I know that's mathematically impossible, but that's how it is. When we treat them down to 10 metres, it's a slightly shorter table. Our more unwell patients, we might treat them only at 10 metres. We don't take them quite so deep. In patients with severe life-threatening conditions like scuba divers that might have decompression illness, then we usually treat them down to about 18 metres, so they have an 18 metre table. We treat people with necrotizing arachnidism and other gas gangrene, necrotizing fasciitis, Fournier's gangrene, a number of different anaerobic infections at those sort of deeper depths. Carbon monoxide poisoning is treated at those deeper depths. So what do we treat typically? What does an average day look like? Well, our unit might do 4 runs, 3 to 4 treatment sessions. In each session, we've got between 5 and 6 patients with a nurse inside the chamber on each session. And those patients will be treated typically at 10 or 14 metres for a period of about 90 minutes of oxygen, 80 to 90 minutes of oxygen. Those patients are treated usually daily, and they'll start with 20 treatments, and they may have up to 30, or some even go to 40 treatments typically. So if you're thinking that you're having a daily treatment Monday through Friday, the weekend off, Monday through Friday, there's 10. So 20 treatments will take about a month. So it's a course of therapy. It's not just a single one-off dose of hyperbaric oxygen. And what we're trying to achieve, well, it really depends on the presentation, why the person is in there. The majority of people that we will be treating will have problem wounds. So think chronic indolent wounds that are just not healing. Maybe there's a really resistant type of infection there, and we kind of just need to be able to use the oxidative burst of their immune system. We enhance that with hyperbaric oxygen. So somebody with problematic wounds, poor circulation, so you think of diabetics with neuropathy, you think of arterial ulcer disease, venous disease, these problem wounds. And the breakdown of tissue after somebody's had radiotherapy. So if they've had radiotherapy for, say, head and neck cancer or prostate cancer or cervical cancer, sometimes that radiation, one of the downsides to radiation therapy is that months, even years later, that tissue that was irradiated back when you had your cancer cured, that can spontaneously start breaking down. And when it happens in bladders, of course, people, have bleeds from their bladders, and they get a very nasty radiation soft tissue injury, and get a cystitis from that. So we've got a lot of patients that we're treating for cystitis. And what the hyperbaric oxygen does for those patients is that it stimulates the process of neovascularization. We want to assist them to grow new blood vessels. And that's fundamentally what it's doing. It's helping them to grow a new bladder wall in those contexts. Hyperbarics is also used for crush injuries. It's certainly used for divers with decompression illnesses. It's used in patients that have had head and neck radiation therapy, where they might get radiation injury to their jaw, so bony injury. Osteoradionecrosis, it's called. It can help to revascularize bones so that they can start growing their jaw back, essentially. If somebody's had a graft that's not taking, a really dusky graft that looks like it's just not going to take, then hyperbarics certainly can help to oxygenate that graft and keep that graft alive, to give longevity and increase and improve the chances that that patient that's had a flat repair will actually take. So there's quite a lot of modalities. There's a lot of experimental modalities too, and our chamber actually does do some experimental stuff. Of course, experimental stuff requires that the patient is very, very aware that that it's a research project. So some of the experimental stuff that we're doing is that we're doing a bit of work with long COVID, particularly postural orthostatic tachycardic syndrome, POTS. We don't know why it's working. We don't know why it's helpful, and that's part of the research. We just know that there has been some improvement for people who are experiencing POTS, particularly post-COVID, so long COVID symptoms. It certainly has been trialled over the years for things like chronic fatigue syndrome and chronic pain disorders. We've got a number of patients at the moment that we're treating for sudden sensory neural hearing loss. The other Brisbane chamber, which is situated at the Royal Brisbane Hospital, the Royal Brisbane and Women's Hospital, are treating patients with sudden blindness, so sudden retinal occlusions. And so there's some promise there as well. So there's a lot of research that's been going on. Many people in the past have suggested that hyperbarics is a cure looking for a disease, and there's possibly some truth to that. But we've definitely got a number of diseases that we've got absolute solid evidence that there is a role for hyperbaric therapy. And that's what we do. So no woo-woo, really interesting. Hope that answers some of your questions. Happy to take any specific questions. Bye.